So let us study this case notes. Peter Hendrick. So first we are going to see Peter Hendrick. Writing task. Mr. Peter Hendrick. The case is myocardial infarction. Writing task. So first we will start with the address. Then the date, the salutation, the subject, the body, the leave taking at the leave taking, or you can say the closure of the letter and the sender's particulars. We'll deal with this one by one. Yeah. First one will take the address. So let us take the address here. Okay, go through the case first. So here we start. Writing this a referral letter. This is a referral letter. Then you're writing a letter to Miss Abigail Devon, occupational therapist, Home Occupational Services, 71 West Avenue, Melbourne, Victoria 3011. So this is the address. Okay. So this is the first line of the address. Miss Abigail Devon. Second line. Occupational therapist. Home Occupational Therapy Services. 71 West Avenue. Write in full. Melbourne, Victoria 3011. So that is how you take the address. Here we got 6 lines. So address we have finished. Next we are going for the date. So the date. All right. So this is discharge medications, discharge, preparing for discharge. Here. Preparing for discharge. So discharge date. Okay. Date of admission, date of birth. So date of discharge, preparing for discharge here. So 9, write the month, July 2019. 9 July 2019. Yeah. So address is done, date is done. Then we go for salutation. Salutation. So the same thing will come here. The first line. Dear Miss, second name. First name will be eliminated. Dear Miss Devon, comma. That is the salutation. So salutation. Then the subject line. Regarding, yes, regarding Mr. Peter Hendrick. So Mr. Peter Hendrick. Mr. Peter Hendrick, date of birth is given. Copy text regarding Mr. Peter Hendrick, comma, date of birth. Date of birth, no need comma. (21 May). Sorry. 1972. So here you put date of birth column. So that is the subject line. So that's it. Then body. Body we are going to write in 5 paragraphs. A, B, C, D, E. So we are going to write body in 5 paragraphs. Then the closure. The closure is, so you check here, the name of the person is there, not occupation. The direct is first line. See the first line. If it is the name of the person, then you write yours sincerely. Yours sincerely, comma. That is the closure. Then the sender's particulars. Sender's particulars, you'll go to the beginning of the letter. You are the registered nurse, cardiology unit, St. Patrick's Hospital, Melbourne, Victoria. So you got 5 lines. So registered nurse, cardiology unit, St. Patrick's Hospital, Melbourne, Victoria. So these are the preliminaries. So Kiran, Kaur, Vinci, Deepak and Chaitra. I hope it is clear for you all now. So no need to write 9 July comma, just you can write as it is, how I have given here. 9 July 2019. Yeah. Is it clear? I just need a yes or no. If you have any doubts, you can ask me here, because we are going into the body of the letter. Deepak, Chaitra. Good. What about the others? Kiran and Vinci. So, right. The body of the letter is into 5 parts. First one is the introduction. And the last one is the conclusion. And this is body paragraph. Main body paragraph 1. And then main body paragraph 2. Then main body paragraph 3. So that's what we are going to do now. 5 body paragraphs. Okay. So having consolidated the first, second, third, fourth, and then the 6th and 7th, now we are going to the main body paragraph. Main body paragraph. First one will start with the introduction. Introduction. In the introduction, we'll start with, yeah, let us take here. So Mr. Peter Hendrick, 1972. And today's date is 2019. So 72 to 2019, he's an adult. That's enough. So 28 plus 18. So you can see 28 plus 18. Okay, about 40. Yeah. So Mr. Peter Hendrick. So you can just say second name, Mr. Hendrick, Mr. Hendrick. So check the spelling carefully. H-E-N-D-R-I-C-K, Hendrick. Mr. Peter Hendrick. So Mr. Hendrick. Second name is enough, because we have already introduced regarding Mr. Peter here. So we are going into the body now. So first we are dealing with the introduction. Right. So Mr. Hendrick. Now let us see, what is this? Diagnosed with myocardial infarction. Diagnosis is done, myocardial infarction. So you can say, who was diagnosed with myocardial infarction? Be careful with the spelling. Mr. Hendrick who was diagnosed with myocardial infarction. So now, purpose of the letter. So requires what? Requires him to visit Mr. Hendrick at home. So requires home visits. Requires home visits. So to whom are we writing? Occupational therapist. So requires home visit. Requires home visit. So home occupational therapy services. So home visit. Requires home visit. Requires home visits. Okay, home visits for what? Provide advice on returning to work, driving. So these are the things. To provide home visits. Okay. Yeah. Provide advice on returning to work. Home visits and education regarding. So he needs advice or education, counseling regarding return to work. So education regarding resumption of professional activities. So resume to work. So return to work. We are changing the words. Resumption of professional activities, comma. Then next one. So we have added here home visits. So to visit home. So this we have taken home. And then providing advice on returning to work. That's we have done. Then driving also. Driving and normal daily activities. Activities of daily living. Activities of daily living. Then discharged. So discharging. So following the discharge back home. So that's it. Following the discharge back home when today. Right. So discharge. Right. So discharge, preparing for discharge. So following the discharge back home today. So today you are preparing for discharge on this day, preparing for discharge. Okay, fine. So now, so this is how you are going to write the introduction. This is how you are going to write the introduction. So introduction. Okay, clear? So yes or no? Any doubts? Ask me now, because we are going into the body of the letter. Mr. Hendrick, name of the patient, who was diagnosed with myocardial infarction and requires what? Purpose. Home visits and education regarding resumption of professional activities, driving, and activities of daily living. Yes. Oh, battery. Yeah. Yes. Yeah, we can check that one. Very good. You have given a good point. Professional resumption of work, driving, and activities. Yeah, resumption of professional activities. Regarding resumption of professional activities. Suggestions for driving. And performing performing activities of daily living. Okay, here we can change professional, professional roles. Change anyway you can. Regarding resumption of professional roles, suggestions for driving and performing activities of daily living following the discharge back home today. Yeah, we can modify accordingly. So here home also, yeah, back home today. Yeah, he's going home. So home visits, that's understood. Back, discharge back today, back home today. He's going back home, so it's better to write like that. So next. Yeah, that is number one. So main body paragraph 1, what will you write here? Main body paragraph 2, what will you write here? Main body paragraph 3, what will you write here? Main body paragraph 3 will be the discharge plan. We'll write about the discharge plan. Okay. Now here you will write during hospitalization. During hospitalization. So action taken during hospitalization. Progress during hospitalization. Or action taken and progress during hospitalization. This is upon admission. So like this you can take along with upon admission, you can talk about his history and other things, whatever. However, you can modify histories. Okay, different histories you can write. So it differs from letter to letter and person to person. Fine. So these are the 3 main body paragraphs. Okay, that is introduction. Conclusion almost will be like the same. Yeah, based on the aforementioned circumstances, comma, based on the aforementioned circumstances. Okay. Counseling. There we have said education. Counseling. Counseling for, yeah, counseling for or advice for resuming work. Counseling for guidance for, advice for, guidance. Change the words and write. Or suggestion. Okay, suggestions we have already taken there. So counseling for counseling for okay. So refer to occupational return to work interventions. Yeah. Intervention, you can use the word intervention. Okay. Counseling for workplace assessment or workplace assessment. Okay. How he is going regularly, then afterwards to continue. Workplace assessment, whether he's capable or not, you have to write. or how he has to manage. Okay. You can also say interventions, professional intervention regarding workplace assessment. Like that also you can say, try to improve the quality as far as you can. Try to, okay, professional guidance, professional suggestion, professional counseling, expert, counseling by expert, you can say. For workplace assessment, so based on the aforementioned circumstances, based on the above conditions, based on the circumstances discussed above, or in view of the above. So, yes, good evening, Dil Rashid. Necessary counseling for workplace assessment, comma. The next one, place assessment, resuming driving, and routine daily chores. Okay, chores, is it what type of word? Yeah. So yeah, it's a C1 vocabulary. A job or piece of work that is often boring or unpleasant but needs to be done regularly. Yeah, it's a C1 vocabulary. You can use it. Routine daily chores or household activities. Routine personal activities. Personal chores would be profoundly beneficial. Full stop. In case any additional information is deemed extremely relevant, please do not hesitate to contact me. Full stop. So this is the conclusion. We have done with the conclusion also. The introduction over, the conclusion over. So, good evening, Girija. Right. So, now we'll go to the main body now. So, conclusion. Clear? So, just give a yes or a no. If you have any doubts, you can ask me. Yeah. Just give a yes if it is clear. If you have any doubts, you can ask me right now. So just hit a yes. I don't know, I'm waiting for your response, please. Yeah, almost the same. Some changes you can do accordingly. It's not the same. For something, maybe workplace assessment. Here in this letter, resuming driving and routine personal. In other things, ongoing care and appropriate management. You have to modify accordingly, but don't use the same words. For example, in some places we use evaluation or assessment, definitive diagnosis, okay, like that. Based on the letter it is. So for this letter we are using these because they are given in the letter. Yeah. So now we'll have to go to the discharge, so histories. So this is related to histories and admission. Then this second paragraph and the discharge plan. Okay. So these are remaining now. So main body paragraph 1 upon admission. Yeah. So main body paragraph 1 upon admission, histories, main body paragraph action taken. So in some letters we can use admission and hospitalization together, and then you can take histories. Depends on letter to letter. Okay, now let us see this letter today. So these are discharge medications. This will come in body paragraph 3. So this is main body paragraph 3. This is the discharge plan. This is the discharge plan and discharge medications. These two will go. Okay. Discharge medications and discharge plan. Here also same. Both these things will go into the third paragraph, main body paragraph 3. Very important. Don't miss anything from here. Don't miss anything from here. These are must. No point should be missed here. Every point should be discussed. Every point should be discussed. All right. Refer to occupational therapy. So we are writing that one and return to working conditions. That's all. No need to write again a referral to the occupation therapist is provided. No need to write. So all these things you have to discuss. Then here. So this is medical treatment. So social history and medical treatment, diagnosis, medical history, occupation, dietary habits, family history, social history, all these things. So medical treatment, this you can see. So we don't have a presenting complaint. So this is, okay, presenting complaint. So this is upon admission, main body paragraph 1. You can take this main body paragraph 1, right? So then you can also say, yeah, presenting complaint. Along with this, you can discuss the histories. Okay, you can discuss the histories. Then medical treatment. This is during hospitalization. This is main body paragraph 2. Main body paragraph 2. Main body paragraph 2. So this is how you can go through these points, right? So now you can see here. So presenting complaint. So date of admission. You can see this is the date of admission. So you can take this one here. So this is date of admission. So he was admitted on this day. So on 2nd July 2019. So we'll take this one. So you can write on 2nd July. 2nd July. So here is the same as we have written. So is it 2019? 2019, yeah, same. So no need to write here again. Just write 2nd July. So 2nd July, 9th July. So 2nd July, he was there for 1 week in the hospital. 2nd July to 9th July, 1 week in the hospital. So 1 week before he joined. So just write on 2nd July. Yeah, presenting, he was admitted. So he was admitted with the complaints of, okay, emergency admission. Emergency brought in by ambulance. Okay, brought in by ambulance. 2-hour history of intermittent discomfort of the jaw. So like that. So this one you can write. So on 2nd July, so Mr. Hendrick was brought in by ambulance. Okay. Okay. Mr. Hendrick was brought in by ambulance. On 2nd July, Mr. Hendrick was brought in by ambulance with a 2-hour history of, okay, this one. With a 2-hour history, 2-hour history of intermittent discomfort in the jaw. Which jaw, upper jaw or lower jaw? We don't know here. There's a little confusion here. Upper jaw or lower jaw? We have 2 jaws, lower jaw and upper jaw. So that was not clear here. Okay, all right. Okay, fine. So in the jaw, which jaw? So there is a question here. It's a doubtful case. It's not very clear. Which jaw, right or left? So that's in the, it can be either right or left. We have a doubt here. Right or left. So that is a question mark. Yeah, we don't know. So there's a confusion. The right jaw, the upper jaw, the upper jaw or the lower jaw. Not right or left, it's upper or lower jaw. There's a confusion, it's not clear. Maybe we'll get later and we can adjust that one. Okay. Maybe somewhere else or he missed it totally. Right. 2-hour history, intermittent discomfort in the jaws. Maybe otherwise you can write in the jaws, plural. Okay, is it singular or plural? Singular means upper jaw or lower jaw, or it may be, you can say, otherwise it can be plural also. So if nothing is given, maybe it should be very clear. If it is jaw, it should be upper or lower, or if it is jaws, no need of upper lower, both the jaws we can say. So that's a question mark here. There's a question mark, singular or plural. Okay, that's not very clear. So mostly official letters will be very clear. Right. Then heaviness in both the forearms. So this is the second point. Heaviness in both the forearms. Forearms from here to here. From here, wrist to, yeah, elbow. Forearms, both the forearms, The next one is constant discomfort on chest. So constant discomfort on the chest. Body part, you have to write the chest. And the last point is, yeah. So this is the last one. Okay. Right. Yes. So not here. Here full stop. Yeah. And constant. So you can remove comma here. The constant discomfort on the chest. So this is brought in, was given an emergency, was admitted on an emergency basis after being brought in by ambulance. So anything you can write here, but brought in by ambulance is very clear. So let us write that one. So this is how you can write. Okay, you can see here. So this is upon admission, right? Then action taken during the hospitalization. If you think that personal histories are important, you can write that. Otherwise, no need. So let us see gradually how they develop. So, yes. So how you did this an emergency admission you had. So we are not sending him. Now he's with discharge. So he's comfortable now. At that time, he had emergency admission. So that's what it is. So upon admission, you can write about upon admission. Right. Then IV access in ambulance, 10 mg IV morphine en route, aspirin 300 mg chewed, glittering spray into 3, ECG showing ST elevation. So, so all these things were done, right? So whichever is important you feel, those you can write to. You are giving to whom? You are writing this letter to whom? So you are writing to occupational therapy services. Occupational therapy services. So what are important for occupational therapists? Okay, so that one related things you can write. Only those relevant to occupational therapy services you can write. Then now during the hospitalization, what did you do? What did you do during hospitalization? So emergency angioplasty. Okay, this was done. ST segment elevation on ECG. So stenting to proximal LAD, FBS, lipids, diabetes, TNL, proteins, CBC, high cholesterol levels. So whatever important to this one. So now you can think about these things. Which is important here? Those only we have to give. Education regarding event. Okay, myocardial infarction, diagnosis and modification to risk factors. Okay. Review by physiotherapist, cardiac exercise program provided. Review by dietitian, diet for weight loss and reduce cholesterol levels provided. Are they necessary? If they are necessary, you can give them. Otherwise, you need not give them. So now, so here, main body para action taken and progress during hospitalization. So you can write one by one. Let us now follow sentence by sentence. How are we going to write sentence after sentence? So how can you make this? We are bothered about the sentence making. How we are going to make the sentence, individual sentence. So let us take sentences now. Instead of paragraph, let us take sentence. For example, works as a driver and mixed shifts. So this is necessary because you are writing their profession, occupation. So this is important. This is important. Works as a truck driver, mixed shifts. Okay. Occupational therapist. So you can write this one here. So histories, you can write about here. He works as a truck driver and has mixed shifts. Okay. Okay, he works as a truck driver and has mixed shifts. So this occupational therapist you are writing. So this information you can write. Then what else you can write? Now, so myocardial infarction related to fast food. Sorry, related to heart. Related to heart. So brother had coronary artery bypass grafting at 70 years of age. Sister had myocardial infarction at 60 years of age. Mother has angina. So you can see here. So strong family history of heart disease. Strong family of history of heart disease. Brother, sister, and mother. So 3 people. So you can understand the seriousness of the disease in the family. Okay. So now he is also almost 45 years of age, something. So you can use this as a strong family history of heart diseases. Okay. A strong family history of heart diseases has been recorded. Okay, this is passive voice you're writing. Or you can say, he has a strong family history. He has a strong family history of heart diseases. Column. You can write the 3 points. 1, comma, 1 semicolon, 2 semicolon, and 3 dash. So first one, okay. So you can write about a brother. Okay, brother had coronary artery bypass grafting, and sister myocardial infarction, and mother has angina. So these 3 things, if they are relevant to this, you can write. If they're not relevant, you can leave. Based on the relevance to whom you are writing, okay, you can write. This is called a listing of things. Listing things. Listing things. This is very special. Okay, listing of things. A, B, and C. So first one is about brother. So brother. Then second one is sister, and then third one is mother. So you can write the 3 histories. Okay. The next one. Yeah. Then medical treatment. You can write about the medical treatment. Okay. Rajni, Vincent, Tasmin. Yes. Yeah. So now let us see one by one sentence in the second paragraph. Emergency angioplasty. Okay, emergency angioplasty. So you can take this point. How are we going to write this? Okay, main body paragraph 2. So emergency angioplasty was performed. Like this, was performed, passive voice. Emergency angioplasty was performed. Don't write capital letters only in the beginning of the sentence. You can write. So that is 1. Then what else you can write? So myocardial infarction was diagnosed. We already have written modifications to risk factor, cholesterol and weight loss. So weight loss, cholesterol and weight loss, both. Education regarding events of a myocardial infarction. You can provide education regarding this. Yeah. So next, this discharge medications. Discharge medications. So upon discharge, these medications are given before or now they are given upon discharge. The current medications on discharge include these things. Okay. Glitrin spray as required. PRN stands for as required. For chest pain, if chest pain persists, glitrin spray is recommended as required. Okay. No driving for 6 weeks. So which are important, those you can write. So no driving for 6 weeks. So how are you going to write this sentence? No driving for 6 weeks. So this will go into discharge plan. Refraining, R-E-F-R-A-I-N, refraining from driving. Refraining from driving or avoiding driving. Okay, or prohibited from driving. He is prohibited from driving for 6 weeks. 6 weeks you can change into 3 fortnights. So change driving for a period of 3 fortnights. Okay, refraining from driving for a period of 3 fortnights is recommended. So passive voice. So he can or driving should be avoided. You can also write like this. Driving should be avoided for 6 weeks. So you can write however you want to write. You write driving should be avoided for 6 weeks. This is normal style. You can get a B grade for this. Refraining from driving for a period of 3 fortnights is recommended. You may get a B plus or A grade for this one. So write sentences, quality sentences, all different. Everything is correct, but only the thing is you have to provide proper grammar and proper style and vocabulary. C1 and C2 vocabulary you can use. Say for example, refraining. What is the power of this? Refraining and avoiding, these two words. Let us see. Avoid. Here the word is avoid. A-V-O-I-D, avoid. What is the level of this word? Avoid. The power of this word, avoid, A-V-O-I-D, avoid. Avoid is B1. Avoid is B1. So B1 level. B1 level. So B1 level is equal to marks. How many marks you will get? You can get 300 marks. 300 marks, roughly 300 marks. Then what is this refraining? Let us take the word refraining. Refrain. Now, refrain is, what is the power of this word? What is this level? Is this also B1? Refrain. R-E-F-R-A-I-N. Refrain. If you take this word, it is C2 vocabulary. C2 vocabulary, and it's even formal word. C2 vocabulary is formal. Formal means highly formal, found in bookish. In books only you'll find. Normally people don't use this word in oral. It's a bookish word. So formal means the form, written form they use. So oral you talk avoid driving. So refrain from driving. So refrain is C2 vocabulary. Now what is C2 vocabulary? So it is C2 vocabulary. C2 level. C2 level means you will get 450 plus marks. 450 plus marks. So try to understand 300 and 450. C1, sorry, B1 is 200 and B1, A1, A2. A1 is 0 to 99. A2 is 100 to 199. B1 is 200 to 299. So 300 maximum. So it is 299. Okay, 299 marks maximum. So it will be 200 to 299 marks. 200 to 299 marks. C2 is 450 to 500 marks. Okay, so this is the way how it will be. So what are these levels now? Levels of vocabulary. So let me give you these levels of vocabulary. A1 level. A1 level will be, you can say 0 to 99 marks. Okay, 0 to 99 marks. Then A2 level. A2 level, you will get marks 100 to 199 marks. Roughly I'm giving, okay. So I can show you this one afterwards in the official also. B1 level will give you 200 to 299 marks roughly. Okay. And B2 level, yeah, sorry, B2 level will give you 300 to 350 marks. And C1 level will give you, sorry, 200, yeah, 349, sorry, 349 marks. Then this one will be giving you 350 to 450 marks. And C2 level will be giving you 450 to 500 marks. So this will be 449. Yeah, will not get, okay, C1 will be getting. So this grades in OET, let us take this grades in OET. This is equal to what grade? A grade in OET. This is equal to B grade in OET. This is equal to C plus grade, C plus grade in OET. This is how your marks you will get. This is equal to C grade in OET. And this is equal to D grade in OET. And this is equal to E grade in OET. So these are the grades. So you should understand the importance of what I am telling you. Now let me show you vocabulary. Focus on vocabulary is very, very essential. It's very, very essential to focus on vocabulary. This is based on CEFR levels. CEFR levels. We call them as CEFR levels. This is Central, 1 minute, European framework of for languages, okay, CEFR levels. So let us take this one. I'll give you that one now. OET grades and CEFR levels. So there you go. This is, yeah, this is CEFR levels. OET is talking, relating the occupational English test to the CEFR. See here, we are not bothered about any others. So this is Coles caliber, it seems. We don't want that one. Edu benchmark, we don't want that one. We are going to the official OET. Okay, I'm opening that one. It is a PDF. It's a PDF. You can download this one and read this one very carefully. This is a very important point. This, you can click on this one and save this link, and then, okay, I'll give you in a Telegram channel also this PDF. You can, yeah, I'm going to put you in the Telegram channel also. This is, yeah. So this is official website. Official website is giving you this one. Now let me download this one. Okay, let me download this one for you. OET Pro CEFR levels. Okay, this is common vocabulary. This is related to vocabulary. Yes. Now I'm opening this one here. Sorry, don't want to open here. Yes. CEFR vocabulary is here. So I'm showing you this one. Now you can see here. Now here it's very clear. Try to understand this one. B1, A2, A1 or failure. Try to see that one. Okay. So we are not bothered about those things. So these are very, very important. You can notice this one. This is very important. C2 vocabulary, that's what I was telling you. Will give you 415 reading, 415 writing, 415 listening, 415 speaking. So if you know these words, you will get these grades in writing or reading or listening or speaking. If you use a C2, C1 vocabulary, you will get a B grade in all the four. So try to understand this. Okay, I'll tell you what is CEFR afterwards. Then if you are using B2 vocabulary, you will get only 200 plus. Okay, this is the maximum score, minimum score. This is the minimum score. 450 above you will get. 450 above you will get. And this is 350 above you will get. This is 200 above you will get. So B1, A2, A1 or down. So try to use C1 and C2 vocabulary as far as possible. If you use C1, you will get B grade. Okay. If you use C2, you will get A grade. So in all the four skills, so vocabulary plays a prominent role. Now, what is the CEFR levels? CEFR levels means Common European Framework of Reference for Languages. That is CEFR. Okay. This is for occupational English test. Okay. So that's very, very important. We call this CEFR levels. Okay. So that's it. So focus this one. Go through this. Okay, the test is designed. The four tests are designed to access occupational English at levels B2 to C2. So try to understand this. Based on this, it's very essential, and many people do not even bother about these things. So we have to bother these things because it's very, very important. So this is relating to the occupational English test to the CEFR. Why CEFR is very important? You have to follow this. So learn quality vocabulary. How do you get this quality vocabulary? I'm telling you. I gave number of, so you can just check here. Cambridge, in our classical corrections channel, you can go and type there Cambridge. Then immediately you'll get a lot of words. See here. This is ambiguity. If you just click on this, it will take you to Cambridge Dictionary. It is C2 vocabulary. See that where it is taking you. It's taking you to C2 vocabulary. Ambiguity, confusion. This is today's word which I gave you. Okay. Next, if you want to go to the previous one, yesterday's word. Yesterday's word is complementary. What word is this? Complementary. It will take you. So complementary. So try to understand this. What is complementary? Complement. So compliment is C2 vocabulary. A remark that expresses approval, admiration, or respect to somebody. Compliment. Respecting somebody's words. Compliment. Okay. So complimentary. An action that expresses approval or respect. C2 vocabulary. Okay. So compliments. Very, very special word. To praise or express admiration from someone. Okay. A remark or action that expresses approval, admiration, or respect. Okay. To express your approval, admiration, or respect to someone that person's character, skill, you have done a good job. That's a compliment. It's a special word. Try to use certain words like this. And then if you go to the next word, see all our Cambridge words. Anticipation. Go to Cambridge Dictionary. Anticipation is C2 vocabulary. Always anticipate good results. Okay, in order to anticipate good results, good recovery process, you should be compliant with medication. Compliance. Now let us take the word compliance. COMPLIANC. Compliance. Compliance is formal. Compliant. Okay. So you can see these words. Okay, compliant, used to describe obeys a particular rule or law. So compliant. Obedience to suggestions, and compliance. So compliance is formal, the act of obeying. Medication, medical, the fact of obeying a particular law or rule. Compliance. So it's a very special word. Try to use these words. Comply. So let us take comply. Comply is C1. Compliance is more than that. So comply is C1, formal word. Compliant, compliance, derived more, it's a better word than that. So complying, compliant, compliance, medication compliance, medication non-compliance. Use such words. Okay, it's very, very powerful. So try to use excellent vocabulary and good words. Selection. And here you see resemblance, resemble. So resemblance is C2 vocabulary. See, I have given a number of words. Just to go there and type Cambridge and you'll get a lot of vocabulary. Resemble, okay. Interpretation is C2 vocabulary. Based on the interpretation of the doctor, based on the interpretation, okay. So how well you interpret, okay. Explain your opinions, okay. An explanation or opinion, what such thing means. Let me interpret your condition in realistic terms. So how well you are using these words, very important. So all of you, what you can do is go to the Telegram channel and take these words. So arbitrary, C2 vocabulary, based on chance rather than being planned or based on reason. Arbitration. So yes, arbitration means for decision making, you have to decide. It's not order, it's not rule, or it's not regulation. According to the situation, you can deliberately decide the plan. Okay, deliberate. See, this is an arbitrary discussion, because when the things were going on, suddenly something developed and we are starting on vocabulary. So how much important words are, okay, how important the words are, you have to notice. Then let us see some more words here. Yeah, venture. Venture is C2 vocabulary. Okay, venture is C2, a new activity usually in business that involves risk or uncertainty. So do not venture into drug addiction. It's a disastrous for you. Don't go forward. Don't start a new activity because it's harmful for you. It's the risk for you, which cannot guarantee good health if you get into drug addiction. So like that, okay? So use certain words in a general sense that will definitely help you a lot. Then next word is persistent, 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 lasting long. It is C2 vocabulary. Persist. If chest pain persists, if chest pain persists, in case of persistent chest pain, so now we got a word here related to our present letter. Let us see here. So now here, what is that? PRN, glittering spray, glittering spray, PRN, chest pain. If chest pain persists, in case of persistent chest pain, glittering spray is recommended as required, as necessary, according to the requirement. See, persistent, it's continues, it prolongs, persistent. Let us take the word persistent. Yes. So now, lasting for a long time or difficult to get rid of. Okay. In case of persistent chest pain, or if chest pain persists, okay, glittering spray is recommended as required, according to requirement. So persistent, what is the level of this word? It's a C2 vocabulary. So how well you are playing with the words is very, very important, because I have told you a number of letters. I have explained you many letters. I have explained you sentences, lines, vocabulary. But now I'm focusing on C2 vocabulary, and is how well you will use these words. Now I want you, let me ask one or two doctors and one or two nurses. Yes, first, Sumant Goyal, Dr. Sumant Goyal.
Yes, sir.
Do you understand the importance of C1 and C2 vocabulary? Do you know these things, or are you learning it for the first time?
Sir, idea was there, but not complete and precise about it. But now I am learning it more, that use of the formal words will increase our chances to be in the top grades of OET.
Yes, you got it
As
right.
other words, the synonyms of it that are less formal or informal, like persistent is, you can say, continuous, would be getting us less marks as compared to these highly this formal words that we use in books and texts that we read in the journals, medical journals.
Yes, thank you. Thank you very much for your response. Next, let us ask another doctor, Ahmed Abdullah Rashid. Yes.
Yes, sir. Good evening.
Yes, what is your opinion regarding this? I have been explaining for almost 15 to 20 minutes about vocabulary. Do you digest what, are you able to digest what I'm explaining, or do you consider this as a mere nonsense or unnecessary for our OET? What do you think? I have given you the proof. Now, what do you
Yes,
think?
sir. Yes, it is very valuable, and formal words we should use. If we used, will get the highest mark, possible marks. Otherwise, you will not get the enough score. It is very valuable, and actually, I learned from you for the first time.
Yes, those are the discussions. Those are the suggestions of doctors. Now let us take two nurses. Here is a nursing teacher, Girija Franklin. Hello, Girija.
Good evening, sir. Yeah.
Good evening, dear. Long time after you're coming. I think.
Yeah.
Okay, share your experience about this one. What is
Sir,
this?
I was not. Yeah. So after joining your class only, I came to know about C2 vocabulary. I was not aware of this, sir. Yeah. Today was today you went in depth, so that I can. Yeah,
Yes, yes.
it was
So
very useful. Yeah.
thank you very much. And then let us ask Rajni Bala. Rajni Bala, can you share your experience? What do you think I am? Rajni Bala, yeah. So you can unmute.
Yes, sir.
So what do you feel about this?
So, first time I'm seeing these all words, and I think these all are more beneficial for me. I Before this, I was not aware about this C2, C1.
Yes, very good. Use 10 words C2 and 10 words C1. You will not fail in the exam. 10 words C2 and 10 words C1. But grammar should be correct. Okay. Improper grammar will not help you. If grammar is correct and C1, C2 vocabulary, 10 words C1, 10 words C2, you'll definitely pass OET with 350, and 20 words C1 and 20 words C2, you'll get A grade, no doubt regarding that. So that is how you will get scores. So try to use these words. And the last one.
So, excuse me, sir.
Yeah, next one more. Vincent.
Hello.
Vincent.
Yes, sir.
Yeah. What do you think about this, which I'm explaining now?
Yeah, sir, it's a wonderful explanation because earlier I heard that I heard that we can use some formal words, but most of the teachers are teaching that you should go always with the simple words. So I never use the words like this. So I think now I can understand that this is very, very important in the language test.
Yes, very good, very good. In a running race, if you run simply like that, in an ordinary way, general way, normal way, usual way, regular way, okay, routine way, you will not win the game. If you want to win the game, so you have to be extraordinary, you have to be special, you have to be abnormal, you have to be unusual, you have to be unnatural, you have to be exceptional. So that is what is the difference between simple people and special people. Simple people will struggle, special people will excel. So I think you got the idea clearly. So now, so that is how today's session I am focusing on this vocabulary, so which you can use on a daily basis, So next one. Yes. So you can write sentences using this one. Elevation. So what is this word elevation? Elevation means raised. Elevation means raised. Elevated blood sugar levels. Many people write these words. What are those words? Let us take you there. Elevated, raised, or increased. So these are the words. I'm giving you three words, the difference. Raised. That is B1. Raised levels. Raised. The blood sugar levels, sorry. Levels increased, levels raised. Raised is B1. Now let us see increased. Increased is B1. Now let us take elevated. Elevated means also raised. But what is the power of this? It's a formal word. It's a formal word. Elevate is a formal word, a special word. Okay. So the vocabulary is not given, but it is not B1. Definitely not B1. Definitely not B1. So elevated, elevation. Let us check another word, elevation. Elevation is specialized word. So formal word, you can see. An elevation in the blood count. Okay. Readings, blood pressure, readings, elevation. It's formal word. See, formal means formal letter. You are writing a formal letter. So use formal words rather than use ordinary words. So raise or increase, increase, increase. You see, increase is not written formal. It's general, normal, usual. So it's not a formal word. Okay. So opposite is decrease. Okay. Increase, elevate, rise. Now let us take another word, rise. Rise. Rise is B1, to move upwards. So which is better word? Use that one. Better words are two types. One is formal words. Three types of words I want to tell you. There are some medical words also, medical jargon. First one is C1, C2. Use them. C1, C2, definitely use them. Next one, formal words, must use. Must use. Then next one, medical words, awesome. So for example, let us take the word, what is that? Incontinence or continence. Continence. The ability to control when you urinate and empty your bowels. Continence, in majority of the individuals, continence is there. But some people cannot have this continence, the power, the ability to control when you urinate and empty your bowels. They cannot control. They have problem. That's why small children, they urinate in the bed itself. So incontinence, we call it. So that is the opposite of this one. That is incontinence. Now, what is this incontinence? Incontinence is medical word. Remember, it's a medical term. That means when you are using in writing, use this word because you are talking to a medical professional. But when you are using speaking, don't use this word because the patient will not understand what is incontinence. The word which you use depends on the audience. You are writing to a letter to a medical professional, use this word. He has incontinence, urinary incontinence. Urinary incontinence. Urinary incontinence. You can use this word in writing. But in role play, can you use this word? You cannot use this word. So you have to talk in simpler terms. For example, you are talking to a father about a son, or you are talking to a mother about a son or a daughter, then you cannot say, your son has urinary incontinence. What is the doctor? Is that a disease? Of course. It's a sickness. It's a disease. It's a problem. It's an ailment. But it's not a disease like, it's a disease. It's a problem. Problems are different styles. But you cannot say, your son has urinary incontinence. If you say, they'll ask, what is this you're talking, doctor, Greek or Latin or German? He will tell you. That means you cannot use this word with a patient because he does not know. Okay, you can use. But first you explain the thing and then say, this condition is called incontinence, you can tell. But even if you don't tell, no problem. It's not necessary that you can use this word. If you want, you can use this word. Your son has a problem of controlling urine. So he has urinary incontinence. You can add to that one. But this is more important. What explanation in general terms to a layman is very important. I'm a teacher, but I don't know what is incontinence. Then what I will do? I look at you, question mark. Oh, this is a big problem. Maybe that's why he's using medical word. I don't understand this. So try to understand. It's a medical and it's a specialized word. This is a medical jargon, we call it. Medical jargon. Only the professionals, medical professionals know this word. So use this word in writing, but not in speaking. But if you want to use in speaking, use the general explanation first and then tell this condition in medical terms is called urinary incontinence. Be very careful to whom you are speaking. Talk to a child like a child. Talk to an old man like an old man. Talk to an adult like an adult. That's it. Be a Roman in Rome. Okay? You cannot talk to a small boy like a very big person, and you cannot talk to a very big person, knowledgeable person, as if you are a small boy. So you have to level up to the level of the audience. These are all very, very important. To ordinary people, they don't mind. but to a special people, because you are our students of Grandmaster class, you need to know all these things. So focus on these points. Focus on these points. So go to the Telegram channel. I'm giving you our channel link. Go to the Telegram channel and just to type there. Just to type there, Cambridge. And you'll get all the words. See here, there are hundreds of words for years together. I have typed here. Years together. Sensational. See, sensational is C2 vocabulary. Sensational development. Could not believe it. This is not usual progress. You have achieved sensational progress because of your medication compliance. You can use this. Okay. So like that. So approving, positive. Then now any word, just to click on that. Specifically C1 vocabulary for a particular reason. Specifically means for a particular reason. Okay. So any word you take there. Implementation, implement. C2 vocabulary. Implementation of the recommendation. Implementation of the doctor's recommendations are is mandatory. Implementation of doctor's recommendations is mandatory. Implementation is mandatory. Okay. With regard to doctor's prescriptions, implementations is of utmost priority. Utmost. Let us take another word. Utmost. Utmost is C1 vocabulary. Utmost C1 vocabulary, emphasizing how important or serious something is. Doctors recommend it. Medication compliance is of utmost importance. Importance. I'm giving you importance. What is the level of this importance? Importance is B1. Why do I have to write importance? Prominence. Prominence. Okay. Prominence or prominent. Prominent. C1 vocabulary, very well known and very important. Very important means extremely important. Or you can use the word pivotal. Pivotal. Pivotal is also a special word. Okay, not gradable. Pivotal, important. No doubt regarding this one. Okay, pivotal, or you can say basic, fundamental, central. Okay. Undermined, cannot be undermined or underestimated. Undermined, C2 vocabulary. The doctor's prescriptions cannot be undermined, means underestimated. Okay, to make someone less confident, less powerful, okay, less likely. So cannot be undermined. So doctors' prescriptions cannot be made less confident, less powerful, less likely to succeed. They are very, very, very important. Undermine means you cannot undermine. So use the powerful words like this. Okay, use the powerful words. So I think I have given you the letter, how you have to segregation into parts. So upon admission, okay, upon admission, first paragraph. During hospitalization, second paragraph. Discharge plan, third paragraph. Remember that. Once again, I'm showing you. Yeah, here it is. So first paragraph, you will write presenting complaint upon admission. Second one is during hospitalization, medical treatment during hospitalization. Third one is discharge plan. Discharge letter you have to write in 3. Upon admission, during hospitalization, upon discharge. That means before admission, what happened? That is upon discharge. From admission to discharge is during hospitalization. Post discharge is discharge medication, discharge plan. This is the last paragraph. So last paragraph, this is very, very important. This paragraph is very important because what they have to do, this is of high importance in a discharge letter. Remember that. Focus more on this one because each and everything in this is very important. So, I hope everything is clear for you. Then one last question. So, any doubts? Question answer session. Any doubts? Yes. I'm giving you 30 seconds. If you have any doubts, you can ask me. Otherwise, we are done for the day. You can complete this letter and submit this letter tomorrow. Just 10 seconds. Yeah, now let me talk to the other students who participated. Yeah, Tasneem. So, yeah, medications. You are not writing to a doctor. You are writing to a to whom? Occupational therapist. So all the medications are not necessary. If you feel that they are necessary, you can write, because you're not writing to a nurse, you're not writing to a caretaker, you're not writing to a specialist, you're writing to an occupational therapist. He is concerned only about workplace instructions and other health related things. So only those things you need to write. Okay, remember, you are referring to an occupational therapist. You're writing to an occupational therapist. If you think that these are important to an occupational therapist, you can write. Otherwise, just exclude. If you're writing to, if you are a nurse and you are writing to another doctor or a, personal physician or family physician or local physician, and you are writing from a hospital, you are one doctor to doctor, or a nurse as an assistant to doctor writing to another doctor, or a doctor to nurse, or a doctor to caretaker, who is bothered about taking charge of all these things, then only you need to write. Otherwise, because occupational therapist will not give him medications. Na? So if it is related, you feel, you can write. You know the best. So any doubts? Okay, no, nobody said anything. So that's very clear. So good night, submit this letter. Thank you very much. Have a nice day.